Hi, I'm Dr. Stephen Allison. I'm an ophthalmologist and senior lecturer at the University of Pretoria. I've been in clinical medicine for over 25 years, and in that time I have come across diabetes very many times. And diabetes seems to be one of those diseases that we're all familiar with and we all have problems with, and we all have a relative that has one. But all the diabetics seem to be on a single road leading to more and more medicine, more and more insulin, until they get complications, lose their sight, lose their kidneys, and basically don't make it. Now this, to me, seems a little bit incredible that we can, in the modern times, where we can send live footage of Mars's surface to your cell phone, we can't even sort out diabetes properly. With all our clever thinking and all our clever innovation, we've sort of barking up the wrong tree, or we're at least not sorting this disease out. So at the moment, I had a look at it a little bit differently and said, well, maybe we should look at the origin of the disease. Like everything, like every disease, you try and look at what caused this little lot, because if we can sort that out, we may have to sort less complications out. So at the end of the day, this also has a very nice spin-off in obesity, because obesity leads to insulin resistance, leads to type 2 diabetes. So if we can sort the causes of insulin resistance and type 2 diabetes out, we also, as a spin-off of that, sort obesity out, and any inflammatory diseases that you may have, any of the diseases that are caused by too much sugar. So at the end of the day, sorting these problems out is going to give us the answer to diabetes, or very much closer to the answer to diabetes and obesity. So at the end of the day, it's very, very simple. I don't want to give you fancy eating plans and tell you how many reps to do and tell you how fast to go on your bicycle and when to eat and when not to eat and how much to eat and all that. I want to equip you with the knowledge of how things work, how the physiology works, how that physiology, when done not correctly, leads to pathology and leads to abnormal situations like obesity and diabetes. And if I can equip you with these fundamentals, you can take control of your life and sort it out yourself, because by giving it to some guy in a gym telling you what to do, and telling it, and a dietitian telling you what to do, and someone else telling you what to do, your doctor telling you what to do, is you're not taking control. Makes it someone else's problem. And you don't want it to be someone else's problem, it's your problem. And you can take command of that and sort it out. And it's very easy. Less is more. In other words, low carb, high fat diet, squash up your eating window, do some exercise, sort out your stress and sleep. So at the moment, we're sitting with a situation with the four phases of learning, and most of us are in one of those phases of learning in most things. A, you're unconsciously incompetent. In other words, when you're young, you don't even know you don't know. Everything's going well, you eat what you like, you do a bit of exercise, and all is well. Then you start putting on a little bit of weight, and niggles start creeping in here and there, and suddenly you become consciously incompetent. In other words, you start knowing you don't know what's going on here. Then you ask your doctor, you ask your specialist, you ask your dietitian, you ask your gym manager, you ask your Uncle Google or Dr. Google. You consult very, very intensively. You get all this information, so you're becoming consciously competent in what's wrong with you. You're putting on weight, you're pre-diabetic, you've been given a handful of tablets, and you're not sure what's going on here. And I'm going to equip you to be unconsciously competent. In other words, that you take so much command of your own life that you start making the right decision without even thinking about it, because those principles are just so well formed. So join me in the next video, and we're going to take apart the less is more and take you on this wonderful journey to better health and a thinner and more lean you.